Hello, Matthew Bell with Alzheimer'sProof.com. Today I want to talk about challenges posed by allergies. We're in summer, at least as I record this. This is July of 2020, and one of the things that some people have to contend with, including many of our elderly, is different allergy symptoms and things like this. Now, this can pose special challenges for people who can't communicate their discomfort. So I thought of this when I was having an allergy attack myself, which was causing my eyes to be itchy, causing throat discomfort, and I was thinking not only about how a person might have challenges distinguishing allergy symptoms from cold symptoms, but I was thinking about the discomfort a person can be in and how bad it would be if I was unable to tell somebody that I was experiencing discomfort. So first of all, I'm not a medical professional, so this video is, as usual, simply for general informational or entertainment purposes only, and you need to consult an expert in your area, a medical professional, if you actually needed medical advice and assistance. This is just to kind of get your mind going and thinking along some of these lines if you haven't already. But allergies occur in general when a person's immune system treats certain allergens, usually particles in the environment like dust and pollen and mold. They treat that like it was an infecting disease or some kind of a pathogenic agent. So in other words, the person's immune system treats a particle of dust or a particle of pollen as if it were a virus or a bacterium. And the body then produces chemicals called histamines, and these histamines cause the classical symptoms, which we'll run through here briefly in just a moment. But the most common, and really what I'm talking about here, a person can have very serious allergic responses to medications and other things, and that's really not what I have in view here. What I'm talking about here are seasonal allergies. The most common seasonal allergy is going to have to do with pollen. These things in general are often referred to as hay fever. Usually we're talking about things like exposure to grasses, molds, trees, or in a word, plants. There are some specific plants that consistently cause problems for people. Some of them that I just quickly surveyed were lamb's quarters, pigweed, ragweed was a huge one. Various trees that people can be allergic to include birch trees, cedar, and oak. But I have a more detailed list on Alzheimer'sProof.com, and I'll put the link at the end, and I'll also put it down in the description, and I invite you to check that list out if you just want to kind of survey the landscape for things that people are often allergic to, as I have a list of plants basically that are often culprits in that respect. One of the main challenges with a person with Alzheimer's disease is the diminished ability to communicate, and that includes the ability to communicate discomfort. So one of the things that the Alzheimer's caretaker is going to have to be on the lookout for are symptoms that might correspond with either a cold, a flu, some kind of a, God forbid, coronavirus, or allergies. Now, the symptoms are often intermingled. It can be very difficult sometimes to interpret the symptoms correctly in terms of a diagnosis. And once again, don't construe this as medical advice. This is simply for illustrative and informational purposes. But symptoms of allergies can include things like coughing, itchy eyes, itchy nose, red eyes, sneezing, stuffy nose, and also swelling around the eyes. Now, some of these symptoms are going to sound very similar to cold symptoms and even flu symptoms, but unlike cold and flu, allergic responses generally don't have any fever associated with them, certainly not high fever. And there can also be a difference in terms of the production that accompanies them. So allergic responses are often very clear, like the liquid around the eyes and the nose is going to be somewhat clear. It's not going to be heavy with mucus and things like this. But once again, this is my personal experience with allergies, which can be very different. I am not an expert on these matters, but what my point is that you have to at least be somewhat up on these things so that you can detect, because your Alzheimer's afflicted loved one may not be able to tell you that he or she is experiencing distress or even discomfort. We wouldn't want them, if we knew better, to sit and deal with an itchy throat or itchy eyes. So what you're looking for is going to be certain behaviors. Scratching at the eyes. Some of these are going to be very similar to what you would find in a child. You know, scratching at the throat, pulling at the ears and things like that because of possibly itching that they can't explain and can't deal with. But then there'll be more obvious things like the obvious swelling, obviously red eyes, obvious coughing and sneezing, and that kind of a thing. Now, how to treat these, you're going to want to consult, obviously you're going to want to consult your loved one's medical professional, but in general, the various options include things like antihistamines. Some of these are available over the counter. They're over-the-counter decongestants, so in other words, you can take pills for these. nasal sprays, things called steroids that can help to reduce some of the symptoms. One of the concerns is going to be counterindications between the various medications that the person takes, so you're going to want to consult with a pharmacist or some kind of a medical professional, your doctor, your loved one's doctor, in order to determine whether the medications they're already on are compatible with whatever medication you're contemplating adding in. There can also be some natural remedies, so people are well aware, I think, of my affinity for herbals on this channel, but some of the herbs that are sometimes brought in a conversation about allergies are going to be herbs that help to quiet that histamine response. These are going to include things like astragalus, which is also good for colds, butterbur, garlic is another one, goldenrod is one. It's a little bit harder to find, sometimes more expensive. Horehound can help with throat discomfort. Mullein can help quiet tissues in the respiratory tract. Nettle is a very good one. Nettle actually sometimes produces a tactile allergic response. Stinging nettle can upset the skin, but at the same time, nettle in the form of a capsule or a tea has antihistamine properties to it. Rosemary is one, and I've gotten into rosemary in at least 2 other videos. And finally, turmeric. Turmeric just shows up on almost any list you can imagine. If you don't have turmeric on your shelf and you are interested in acquiring various herbs, it is one that is fundamental, and I recommend it highly. In a non-expert, non-official capacity, of course. And then finally, if you have an interest in mushrooms, reishi mushroom is actually one that shows up on a number of lists, including lists of anti-allergy natural remedies. The final thing that you're going to want to do in order to treat these are just going to be keep clean, keep your loved one clean. So if they've been exposed to allergens, you're going to want to wash them. You're going to want to have them wash their hands. Sometimes washing hair of somebody with Alzheimer's disease can be extremely tricky, but the hair can collect different pollens and other things like that. If they're having an acute response or reaction, might be good to give them a thorough cleaning. So bathe them, shower them, including shampooing the hair is probably going to be something that, even though it's not the most pleasant task, is going to provide the best relief. Because despite having medications, if they're just reintroducing or re-exposing themselves to the pollen because they themselves are not clean, then the medication is only going to have a limited effect. But talk of cleaning brings up another aspect of this, which is how do you prevent this kind of a thing from occurring in the first place? Well, one thing is going to be to thoroughly clean, and that's going to include their person, but also the environment. Do things like clean bedding. Now, certain recommendations include temperatures. They recommend temperatures of 130 degrees at least when you're washing sheets and other linen. This has a double edge to it, because one other tip for Alzheimer's in general is to turn the water heater down so that a person who has Alzheimer's disease can't accidentally scald themselves. So this is a difficult one. You're going to have to find a happy medium. If your Alzheimer's afflicted loved one has a habit of fiddling around with the faucets and you're afraid they're going to burn themselves, then I'd err on the side of turning the water heater down. But if they don't seem to have that problem, and I know that's really dicey, you might want to turn it up just a little bit, at least for the purpose of cleaning the bedding, because some sources suggest higher temperatures are going to do a more effective job at cleaning and killing whatever it is that you may need cleaned and killed. Something else people do sometimes is cover their mattresses in plastic to prevent pollens and other things from going down deep into the fabric. You're going to want to demold the bathroom. You're going to see mildew and other things that can cause allergic responses, so a thorough cleaning that's going to remove those. Sometimes bleach does that. Sometimes these are harsher chemicals, so you're going to want to wear protective equipment, and you're also going to want to make sure that the person with Alzheimer's does not go into the environment before it's safely aired out after you've done your thorough cleaning job. Don't use rugs, don't use dusters to dust, because that just spreads the dust into the air, scatters it. Don't use dry rags. If you're going to dust with some kind of a wet cloth, a damp cloth, or some kind of a cleanser that's capable of picking the dust up. You're going to want to launder curtains and drapes periodically, especially being near the window. Those can retain and hold pollens and other allergens. Sometimes you'll even read that people recommend replacing those window treatments with things like Venetian blinds and other things that don't collect dust and pollen the same way. You're going to want to vacuum, and some of the sources suggest that on a weekly basis is probably sufficient. The best kinds of vacuums are going to be air ones that have a HEPA filter, or even ones that are water filtered. And the reason for that is some of the traditional bag vacuums and uprights, they allow small particles to just go into the air because they pass right through the filter, and the vacuum itself can stir up dust and cause allergies to be aggravated at least immediately following the vacuuming. So HEPA filter or a water filtered vacuum are ideal, but obviously budgetary requirements might prevent you from doing that. So sometimes people prefer hardwood floors for the same reason, but they don't have to be vacuumed the same way. Another aspect is going to be to keep the clothes clean. So if you or your loved one has been outside, probably good to change the clothes, launder those clothes, and again, keeping the person clean is going to be a very important aspect of this. But a final consideration, unfortunately for some people, is going to be to simply limit your outdoor exposure. So stay indoors. Don't open the windows. Close the windows and run the air conditioner, and especially an air conditioner that is properly filtered with a HEPA filter preferably. Sometimes you can also get these stand-up filters that are supposed to filter the air. Not sure, you'd want to look at the various ones that you're considering buying for reviews and things like that. They probably also come with product specifications that might help you understand what kinds of particles they filter out. So some of those might be of limited usefulness. They also might be obtrusive, so you certainly don't want to add an upright filter that your loved one might trip over or might fumble with or in some way, knock into or mess with. But those could be an option for people who maybe have severe or acute allergies. Now, the final thing I wanted to say is that, like so many aspects of Alzheimer's care and Alzheimer's proofing, there are a lot of similarities between caring for a person with a diminished cognitive capacity and caring for a child. And in this case, one of the similarities is the fact that, like young children, a person with a severe cognitive impairment is not going to be able to communicate his or her discomfort, and we've already mentioned that. But I did want to mention briefly just a couple of things that might be different. One of the things that might be different is, unlike a child, the older adult probably has a lifetime of medical history, and so it is highly likely that the doctor is aware of certain allergies that have been a factor for that person in the past. Now, that's a decided benefit in your case because getting up on the person's medical history is going to give you an advantage. If you know they have a seasonal allergy, then obviously you can prepare for it in a way that you might not be able to prepare for it in the case of a child. But you should also be aware that allergies can be developed over time, but they sometimes can be lost. So sometimes as a person gets older, they actually lose an allergy, or I guess their body gets used to certain allergens and they're no longer as negatively affected. But in other cases, people can pick up allergies. So sometimes these are medical allergies where a person can become allergic to penicillin or something. But in the case of seasonal allergies, the best thing is to just keep your eye out. And also, we're at an advantage because we know seasonal allergies are probably going to afflict us at various times a year. So oftentimes early spring, summer, early fall are going to be some of the worst times for these. But you know your body, and if you can just keep your eyes open, look for these signs and symptoms, I'm sure that you can implement strategies to help your loved one. Once again, for professional medical advice, you need to consult with your doctor or your loved one's doctor. But if you found something of use in this video, I do ask you like the video, subscribe to the channel, click the notification bell to be alerted to new content as it becomes available. I thank you so much for joining me today, and I look forward to seeing you again in another video. Thank you so much.